Hi, this is Dr. Sylvester, and I want to talk to you a little bit about pain in the ball of your foot. Let's say these are your toes right in here. We get a lot of patients with pain in the ball of their foot, and that's usually a neuroma or something of that nature. And what a neuroma is a swollen nerve between two metatarsals. And what happens is the poor little nerve is trapped between two bones on the sides, a ligament on top, and the floor on the bottom. And usually it's people that are wearing sort of a thin-soled shoe that doesn't have a lot of cushion, and so the nerve gets repetitively compressed, and it causes the nerve to swell up. Now, the traditional treatment when I first started practicing was to remove the nerve, and that really, to me, nowadays doesn't make a lot of sense, because what happens when you remove the nerve is almost always you grow another neuroma. In fact, it's almost 100% unless you take great pains to bury the nerve into a muscle, and there's not a lot of muscle on the bottom of the foot where you can bury the nerve. But nowadays we do several things. First of all, just steroid injections can be very helpful at taking care of nerve pain for long periods of time, many years. Secondly, we can do a thing called thermal nerve destruction, which is where we just insert a probe about as big as a needle and freeze the nerve, and that makes it stop hurting. The other thing you can do, if those all fail, or if you want to go directly to something a little more aggressive, you can actually take the ligament that's on top of the nerve and remove it so that the nerve has a place to go, so it's not always getting pinched, and that can be very effective at decreasing nerve pain. Also, shoe gear modifications can be helpful. If you wear a good arch support, that can take a lot of pressure off the ball of your foot and decrease the pain in the area of the neuroma. Wearing a softer shoe, like a tennis shoe that has a lot of cushion on the bottom, so that the bottom of that box, the two metatarsal heads, the ligament and the shoe, can also be very effective at lowering pressure on your nerves. So try those things, and if everything else fails, you can give us a call, and we can take it the next step further and get you back on your feet and alleviate a lot of the pain you're having on the ball of your foot. Thanks for listening.